There is something we all need to understand about medications that come in liquid form, like syrups and suspension. For syrups, it's quite straightforward. It's a clear liquid that you just take out the measurements you need and you use as directed by your healthcare provider. But for suspension, many of us use it wrongly. In fact, some people don't even know the difference between a suspension and a syrup. For a suspension, it's very simple. You will always see the particles of the main drug suspended in a liquid, and that is why it is called suspension.
You get it?
But there's something you need to understand. After some time, the drug particles that have been suspended will begin to settle to the bottom of the bottle. And at that point where they've settled, if you are trying to use your medication and you pour out the liquid, you will notice that you are not getting enough quantity of the main drug out of that bottle. You are most likely just getting the liquid content, which may be water or whatever has been used to mix the drug particles. And by doing that, the medication will not work effectively for you or your child. And that is why for every suspension medication you find, you will always see a direction that says, shake well before use. Why are we shaking? We are shaking because we want that settled drug particles to redisperse, to redistribute, to mix well with the liquid, so that by the time you are pouring out the main content of the medication. So whether your suspension comes as already mixed or you mix it yourself with water, ensure you always shake well before you use. I'm sure you've learned something today.